A Georgia county that denied gender-affirming healthcare coverage to a trans employee ended up having to pay big in the end. So now, back in 2017, Anna Lang came out as transgender. She is a trans woman. She identifies as a trans woman now. And this is after working for the Houston County Sheriff's Office for more than a decade. So she comes out, and as a trans woman, she has, obviously insurance, the county. And so she comes out and seeks to have gender affirming surgery. Okay. So now she wanted to use her insurance that she pays for in order to cover those surgeries. Makes sense, right? You pay into, your insurance coverage. You should be allowed to use it for things that are healthcare. And this is healthcare. That said, Houston County said, no. We're going to refuse to cover those surgeries because we have exclusions. These exclusions were put into their healthcare plan, and they claim that those were put there in order to save money. Oh, look, we would love to cover it, but it's going to cost us too much. It's going to cost the county too much, and so, and then also if we remove the exemptions, then everybody's going to want to get bottom surgery. Oh, okay. So no, first of all, they're not going to be forced to hand out bottom surgeries like candy because there's only a select group of people that go for that. And that's transgender people because it's part of their health care. Ridiculous. But yeah, again, the argument ends up defeating itself. And I'll get to that. The irony about this entire situation is that the county ended up spending far more to try to keep the exemptions in the insurance that prevents the coverage of gender-affirming surgeries than they would have actually had to pay out to cover those surgeries. So that tells me that this was never about the costs. No. It wasn't about the cost at all. Because let's get to the details. According to a report in ProPublica, Lang had come out and got these, tried to get these surgeries, was denied by the insurance, as I mentioned before, or by the county. She then sent letters to the insurance administrator and the county asking them to remove the health insurance and plan exclusions in both 2018 and 2019. Every year, her appeal was denied. In early 2019, she then went to the County Board of Commissioners meeting to ask if they would remove the health plan's exclusions. The board then denied her as well. Their reasoning, it'll cost too much. Now, the county's lawyers then warned of a hypothetical situation in which an employee could seek multiple surgeries in 1 year. Oh no! Raising the cost to the point of where they just could not afford it. I'm sorry, there's going to be a run on surgeries from employees going and getting multiple surgeries in a year. We just can't handle that. We can't handle it. Or as Trump would say,
can't let that happen.
So they're talking about cost. Well, how much does it cost? According to an expert hired by Lang's attorneys, including the transition-related healthcare in the plan, would add a total of, quote, 0.1% to the cost of all claims, or about $10,000 per year. The expert explains that the amount would be so small that in actuarial terms, it could be considered to be immaterial. Here comes the irony. So in fighting to save this potential $10,000 in a year in increased costs, Houston County spent just $57,135. That's just one expense. This was a budget expert that they hired to make their case that it would be too expensive to cover the gender-affirming care at $57,135 versus $10,000 in a year. But wait, it gets better. Oh, of course it does. Now, after the denials, which cited costs, Lang said, okay, look, this is my healthcare, so I'm going to file a lawsuit. I think I'm being discriminated against. She sued the county for employment discrimination and said that the county, which describes itself as Georgia's most progressive county, so much for that, right, was subjecting her to inferior treatment by denying her medical care. Lang ended up actually using some of her retirement funds and savings to pay for top surgery, but was not able to afford the bottom surgery, which cost approximately $25,000, according to legal documents. But in fighting those claims, Houston County spent, you're going to love this, they spent a total of $1,188,701 in direct payments to private law firms from the date the lawsuit was filed to December 31st, 2022. Oops. The legal fees amounted to 3 times Houston County's annual budget on physical and mental health. So to save $10,000 in a year, they spent over a couple of years nearly $1.2 million. That, my friends, we call an epic fail. An absolute disaster. And one that could be avoided if that county had not been bigoted. Because let's be honest, this was not about the cost. Now, the final kicker here for the county is that after this lawsuit, or I should say during this, right? The county appealed the decision. So they were ruled against, and they're planning to appeal. During the appeal process, a federal judge stepped in, and they looked at this case, and they ordered the county, oh, by the way, for any future transgender employee, you have to cover the transition care. No ifs, ands, or buts. You cannot exclude people on the basis of being transgender. So at the end of the day, they not only spent $1.2 million in legal fees, roughly, to try to stop a $10,000 a year cost to cover transition care. Now they have to still pay for the transition care. Nice. Oh, I love it. I love it. So, yes. Now, Anna, getting back to her, she described the effort to fight for her health care. And the way that she was treated by the county as, quote unquote, a slap in the face. And said that they're treating it like a political issue. Obviously, when it's a medical issue. Look, at the end of the day, like, you have to understand, gender-affirming care is healthcare. Simple as that. That's it. It is healthcare. I don't know. Maybe this is a bad comparison, but like something that the county and a lot of health insurance plans have no problem covering is things like Viagra. Maybe you could argue, and maybe this is a bad argument, but you can tell me. You can tell me if this is a terrible argument. But like, I could see Viagra as part of a gender-affirming care, right? Nothing makes you, I would assume that nothing makes you feel less than a man than having ED. And getting care for it makes you feel whole again. Like you are who you're supposed to be. And again, maybe terrible comparison, okay? Or, whatever. And again, you can tell me if that's the case. But nobody ever makes any sort of fuss when you cover that kind of stuff. But try to cover gender affirming care, which is healthcare, well, I mean, they'll look at that, these insurance companies in these counties, no, they'll have a real problem. But again, as we just saw, this is, the costs are far less to cover these transition surgeries, which are necessary, than it is to discriminate against a transgender person. It just costs you more in the long run to be a bigot. Which tells me it's not about the cost. It's always been about the bigotry. They argued that this could cause a run on surgeries and just inflate the costs. That's not the case. This is just part of a fear-mongering campaign by certain groups that, say that if we accept trans people in society and allow them to get the gender-affirming care that they need, that suddenly everybody's going to go trans themselves because, hey, it's covered by insurance. Why not? It's the same weirdo argument that some people have made against giving people universal health care, like Medicare for all. What if you give everybody health care? Then they're going to make runs on the hospital and get all these surgeries done and elective stuff. Well, first of all, if there is a run on, hospitals to get care, that's probably because people, due to the cost of healthcare in this country, couldn't afford to do these things before. So maybe there's a little truth in that. And maybe even a little bit of truth in that when it comes to people who are identify as transgender who couldn't afford to get these gender affirming surgeries or gender affirming care, finally coming out and saying, okay, look, now I can actually get the stuff that I need for my healthcare. But at the end of the day, there's really no difference between those two examples because healthcare is healthcare. Gender affirming care is healthcare. And that's what it is. And look, trans rights are human rights. They should be able to get the care that they need. We just need to allow trans people to live their lives, to live their truth, to be who they are. And look, as a result of this, by the way, Anna, she is actually starting the process of scheduling her surgery now that she had won the case. I wish her all the best. As she moves forward with her life, living the way that she wants to be, living her truth. And I also want to give her huge credit for not giving up. This victory wouldn't be here if Anna had not stood up for herself. And in so doing, she not only stood up for herself, but every transgender person in Georgia now has the ability to get their gender affirming care. And it may not be a lot of people, but it's a huge victory for equality nonetheless. And so I just want to give her a huge, huge credit for doing that and for standing up for herself, her community, and living her truth. It takes a lot of courage to do that.